High cholesterol is a silent killer that affects millions of people and contributes to nearly a quarter of all deaths in Australia every year. Now, leading heart charities have teamed up to launch the country's first ever Cholesterol Awareness Week, and they're offering free screenings this weekend at Velo 500. Dr Christian Verdicchio, CEO of Heart Support Australia, is here to talk us through it. Thank you for your time. This has never been done before. What do we need to know about high cholesterol and what's the goal of this Awareness Week?
Yeah, look, thank you for having me. Three organisations, Heart Support Australia, Hearts for Heart and Heartbeat of Sport, got together last year to talk about cholesterol, and we're working around trying to raise awareness of this issue because it's the leading cause that results in myocardial infarctions or heart attacks and strokes. And when we think about cardiovascular disease, 1 in 4 deaths are actually attributed to it. And we decided to get together to work with a bottom-up approach. And Cholesterol Awareness Week is kind of the first kind of consumer-led awareness campaign nationally, but we're running an activation at Velo to try and raise awareness of cholesterol. It affects 40% of the population. And when you kind of think that 2/3 of the population are actually overweight or obese, there should be a lot of people getting their bloods tested and to be screened for cholesterol, seeing the significant effect it can have long-term.
And there are no symptoms, are there?
No, traditionally not. I mean, you get high cholesterol is a build-up of fatty plaque within the coronary arteries, and when we kind of think about what happens, it progresses to a point of when a piece of that fatty plaque breaks off, and it can result in a heart attack or a stroke. So typically, the symptom only presents when you're actually in an emergency department, having chest pains, or perhaps having something such as a stroke itself. So it typically doesn't present anywhere else, but can be picked up early if we can actually just go get screened for it.
Talking of screenings, you're offering free heart screenings at Velo 500 a little later in the week from Thursday. Who can get one and what's involved?
Everyone. The more the merrier. We have an activation there that's being done. Anyone who's interested about getting their cholesterol tested, and we're doing a full bloods on the day, which will take about 10 minutes, can come to the site activation, get their assessment done and kind of see how they go in terms of next steps and whether they need to actually have that discussion with their GP or cardiologist about perhaps, lifestyle modification or perhaps even medication intervention.
It's a fantastic initiative. Outside of this week, what are the steps that people can take to be more aware of and to manage the risks of heart disease?
Yeah, just go to your GP. It can happen to anyone. I'm young, 34, 35. I have 2 kids, and I'm relatively fit, but I still get screened every couple of years and do my bloods with my GP. So it's as simple as picking up the phone, booking an appointment with GP. We know they're a bit time, conscious at the moment, poor. There's a lot of people, but it's worth the wait. The last thing you want to do, it's too late and you're in an emergency, after a stroke, after a heart attack, or may not even be around to see your loved one. So go to your GP, get a heart health check. It's funded through Medicare. If you already have an existing cardiologist and it's been some time since you've seen them, go back to them and have that discussion again about looking at your cholesterol levels and seeing what you can do to bring them down to normal levels if they are quite high.
Okay, Dr Christian Verdicchio, thank you so much for joining us.
Thank you for having me.